This is Dr. Serkan Dinar, consultant plastic surgeon. Today we will talk about the rhinoplasty, the nose job surgery. This is the historical surgery of the plastic surgery, it has a long time, its beginning takes like a long time ago. And in today's, we still perform the nose job as well for the broken noses and for the aesthetic surgery. For the rhinoplasty, we usually check the breathing first, because breathing is important, and this surgery is for the aesthetic part and for the health part has to be together to make you more healthy after the surgery. If you have the breathing problem, we usually check the septal cartilage inside the nose, because septal cartilage may break, or you may have the breathing problem since the birth. And if you have the septal cartilage deviation, so we have to correct the deviation first, then we have to go on with the bony part. For the bony part, we have to check if you have a hump, bone hump. If you have a bone hump, we have to remove some part of the bone to make the nasal tip up. And actually, it's changing patient by patient, because most of the people have the different types of nose. And the skin thickness is the important part, because if you have a thick skin, so it's more harder to give a good shape. So we usually use different techniques with the thin skin patients and the thick skin patients. And about the technique, we have two techniques. One is the open technique, and the second one is the closed technique. I usually perform the closed technique because on open technique you have to open an incision from the tip of the nose, and that may create a scar. So to keep from the scar, we prefer to the closed technique. In closed technique, we enter from the nostril of the nose, from the inside. The incision will be hidden, and then from inside we dissect the nasal skin. We remove the bones, we break the bones, and then on open technique, as I tell you, we have to open an incision. But sometimes, if you have a big problem with the tip of the nose, we may decide to do it with the open technique. As I say, we have two techniques for the rhinoplasty surgery.